Is Dr. Julio Gonzalez, and welcome to the United States Medical Association live stream. I've got the live stream here on my computer, which is distracting me. Let me put that out of the way so I don't have to see that. Anyway, welcome to the United States Medical Association live stream. It's been a while since we have spoken. Had a rough week last week. Lots of hip fractures, lots of all sorts of things that kept me in the hospital and away from the live stream. And I guess that's a good thing in one sense. But man, it took away our momentum from being able to address the issues of that are affecting medicine today. Lots of things have happened. And today, what I want to talk to you about primarily is I want to talk to you about whether doctors are being paid too much. That's the question for the day. And I've got so much data here to present to you that there's no possible way that I'm going to be able to do it in the amount of time that we have available, but I am going to avail myself of as much of this as possible because it's incredibly important that we address this. Because the answer is absolutely not. Absolutely not. We're not getting paid too much. And we'll show you why. Now, the impetus for this live stream topic is this article, study that came out of Medscape. Now, it's one of those articles that are completely biased because they do it in such a way to make sure that you get the information that you want to present to make the case that you want to make. It doesn't really show inherent bias, but just the mere fact that they did this displays the bias. And the bias is the study is getting a survey of physicians in the United States, trying to figure out how much they get paid, how much they take home, and comparing that with reimbursements to other countries throughout the world. And obviously, the question that they asked the question in the title of their study is: are American physicians being paid too much? Well, I think we should get into the methodology, and I think I figured out how to show you this. Let me see. There it is. There's the methodology. So this is what they used to formulate their information and their plan. They surveyed physicians throughout the country, United States, Canada, throughout the world, United States, Canada, Europe, etc. And then they got those survey results, and it was a 10-minute online survey, which immediately demonstrates to you their bias. And they tell you they got about 1.1% of those responding were from the United States, 4% or so were from Canada, 5.4% were from Portugal. You can see the rest, 3.3% from Spain. And what they did is they amassed some data. And the data is, essentially how much you get paid, how much women get paid, are you satisfied, how many patients you see a month, that kind of stuff. And let's go over this a little bit because it's really a fascinating topic of discussion. And here's the underlying thing. The underlying thing is the question over whether someone in the United States, some entity, some force, some authority should be regulating how much you make. Because after all, healthcare is incredibly expensive in the United States. It takes up, 21, 26, 17, 20% of our budget, of our GDP goes to healthcare because we have the audacity of caring for our loved ones. And that cannot be. We cannot allow that to stand. We have to cut pay. And if we're going to cut pay, we need to cut the pay of those dastardly doctors. Because, scene 2, I think, I have the payments in the United States in the United States here, and then you can compare them to those with the rest of the world. But before I do, before I show you those numbers, let me thank you all. I kind of just skipped into the substance without thanking you all for being here. Thank you so much for watching us today. Thank you for allowing us to be a part of your evening. You doctors in the East Coast, we start usually at 9. I think I was a few minutes late. The doctors over in the West Coast, over by California, those guys are at 6 p.m., so we're catching them right after work, probably while they're still slaving over their notes. I wouldn't be surprised if the East Coast doctors at 9 p.m. are still slaving over their notes as they get past their day. Either way, I thank you very much. Please tell your friends about the United States Medical Association. If you're joining us as a patient, thank you so much for being here. Sign up for our emails. Follow us on Twitter and YouTube, which is where we are live streaming right now. For Twitter, the handle is US Medical ASN. US Medical ASN. That is United States US Medical ASSN, short for association. For YouTube, it's the United States Medical Association. So I thank you for being a part of it. Please encourage everybody to sign up for our emails. Visit us at our website and just be a part of the effort that we're trying to promote here. Okay, so here's the numbers. Here are the numbers. That's the study stuff. But here are the numbers. Let's go ahead and show them to you. I got to shrink this down, make this a little bit bigger so I can see it better. And essentially, you can see that America's physicians are earning a significant amount more than somewhere in the neighborhood of $365,000 on the average, a significant amount more compared to those physicians in other parts of Europe. Substantial amount more. And of course, the answer, if you're looking at these numbers, $352,000 for the United States, $273,000 for doctors in Canada, Brazil, $48,000, Spain, $60,000, Argentina, $21,000 a year for your payment as a physician. If you look at these numbers, obviously the answer that you want to say is, of course, those evil American doctors are getting paid too much. Here's another blow-up cartoon showing those figures in another way, in a geographic manner, with, of course, the American number right there, $350,000 for the U.S., and look at how much higher we are than Germany and the United Kingdom and Italy. And now we go to South America, and you can see that as well. Couldn't pull up the numbers for Africa, but suffice it to say that the American physicians are getting paid more than other physicians throughout the world. So there's two things that we got to answer. Number one, are we really getting paid too much? Number two, should another agency, should an outside force be regulating how much you make? Now, for the first question, which is, are we really getting paid too much? Well, look, the answer to that question, there's two answers to that question. There's two answers to the question of whether we're getting paid too much. Two true answers. One is the following question. Are you going to do this if you're not given the possibility of making $352,000 a year? I mean, think of what you went through, doctors. Think of the 4 years of pre-medical school training. Think about how you took the hardest classes. You didn't take sailing, where the final exam was to sail a boat to Bermuda. Yeah, where do they do that? Well, they did that at the University of Miami undergrad when I was undergrad there, and I didn't get to participate on that because I was taking biochemistry. I was taking biochemistry, organic chemistry, calculus, calculus 2, by the way. Don't forget, it wasn't just calculus 1. You then had to take calculus 2. You had to take biology. You had to take advanced biology. You had to take organic chemistry. Would you have done all that while your friends were at the Rathskeller having a beer, enjoying the football games, and you were at, we called it the stacks, at the top floors of the library, busting your brain, trying to keep just another little factoid in your brain if you were told that you were going to make $41,000 a year? Is that what you would do? Would you sacrifice the time that you spent with your family after you left college? When you finished college, you graduated, I don't know, AOA in the top of your class, because you know only the top people in undergrad are going to be able to go to medical school. You end up going to medical school. You bust your buns at medical school for 4 more years. You accrue a gazillion dollars worth of debt. Your buddies are hanging out at the, CEO parties in their respective banking corporations, enjoying their families on their weekends because they don't have to come into the hospital. Not you. You're busting them, going in the middle of the night, spending all sorts of time away from your family. You don't even know what your kids look like because they've grown since the last time you saw them before you took call. Are you going to do that for the promise of $41,000 on the average? Are you? And then, by the way, remember, it's not over then. For those of you who are following along who are not doctors, it's not 8 years, which we have already done. 4 years of pre-med, 4 years of medical school. Now you go to residency. At least a year just to take your board exam, to take your bar exam, to be able to board exam. You can tell I went to law school too. Take your board exam just to be able to have a license to practice medicine. Just 1 year, just to even have, but you're not going to get hired. Nobody's going to see you with 1 year of postgraduate training. You're going to then have to take 2 more years of internal medicine at the very least. You're going to take 4 more years of general surgery, 5 years in some programs, 4 years of orthopedic surgery. If you want to subspecialize, if you want to be a hip surgeon, or you want to be a transplant surgeon, or you want to be a cardiac surgeon, then that's 1 or 2 more years after that. When you're done, you're 33. When you're done, you're 33. At best, maybe 28, 29. Are you going to do all that for the prospect of making $41,000 on the average? That's one way to measure. And the answer is, I'm hearing it from all the doctors who are listening to this podcast, and I'm probably hearing it from the patients who are watching this, stunned that this is what these doctors have to go through just to get the opportunity to be able to examine you. You're probably saying, no, that's crazy. That's insane for $100,000 with today's cost of living. Here's the next question. The next way of answering the question is, how much would people pay to see you? I mean, you're getting paid too much? Maybe, maybe not. Who's the one that really determines that? The one who really determines that is the patient. It's not Medicare. It's not the insurance company. It's not some sort of agency that decides whether you're checking off the right boxes, whether you're asking people whether they've gotten their vaccinations, when what you do is be an orthopedic surgeon or a plastic surgeon. It's not whether you're asking, you check off the mark whether you've asked them about gun control and gun safety in their home. That's not how you determine whether you're a good doctor or not, and that's not how you determine whether you're providing adequate care or not. But yet, that's the measures that these third-party organizations. What's a third-party organization? Anybody who's not you or your patient. That's a third-party organization. Anybody that's not you or your patient is determining how much you should get paid. No, the one who determines how much you should get paid is your patient. Your patient comes to your office, knows your price. She doesn't like it. She says, forget it. I'm going to the guy across the street who's charging, 3/4 as much. Or somebody else might take you because, you have the world's greatest reputation, and I want to see the best in this town, and your prices are supported by your reputation and your prior performance. That's how you determine whether you're getting paid too much. Not with this survey and comparing you with other countries in the world. Not by what Medicare thinks you should earn. That's a sham. The way to determine whether you're getting paid adequately for your services for examining a patient is whether or not you're providing good care for your patients and your patients are willing to pay for it. So now let's talk about the rest of the story. So let's talk about the rest of the story that these guys are not telling you. I got this pop-up. Let me get this thing out of here. Here's the rest of the story that they're not telling you. What about the cost of medical education in these countries? How much are you spending to become a doctor? Well, in the United States, got it right here, did my research for you. In the United States, it's $241,000 average debt, $241,600 average debt to get out of medical school. That's almost $250,000. Let me say that again. $250,000 to be able to go out there and practice medicine. $215,000, more than $200,000 of those $241,000 is what you're spending in medical school versus undergrad. The 241 combines the medical school plus the undergrad. 215,000 is just for medical school alone. Let's compare that with Canada. Okay? In Canada, annual medical school tuition is $23,000 a year. For the United States, we're talking about $55,000, $60,000, $80,000 a year in some institutions. If you're a Canadian resident, by the way, I'm sorry, let's backtrack. Let's be perfectly clear. It's $23,000 for an American studying in Canada on the average. For a Canadian, it's $13,000 a year. $13,000 a year for a grand total for a Canadian of $52,000 for his or her medical education, compared to $241,600 for an American. You tell me, are we getting paid too much? Israel. By the way, Israel. My prayers, I have been praying with my family for our Israeli friends. The attack on Israel that took place since our last podcast has been absolutely unconscionable. I can't believe I saw that. I can't believe that I saw people flying on ultralights into a concert and killing indiscriminately at all these people who were, ironically enough, demonstrating or dancing or celebrating peace. And yet these people came in and just started slashing away. It's just unconscionable what occurred. So once again, the issue of peace in the Middle East has come up to the forefront, and it has become a major issue. Once again, that may, put us into World War III for all we know. But at least for now, I just want to let you know I've been praying for our friends in Israel, and I have been praying for peace in the area. And I've been praying for humanity to become more sane. Anyway, with that moment of respect and well wishes for our Israeli friends, here's how much an international student can expect to pay a year for medical school tuition in Israel. $38,000. $38,000 compared to whatever we're getting. I don't know, 215. That's a little bit over $50,000, $60,000 a year. If you're an Israeli, it's even less than that. For Caribbean school, if you decide to go to Caribbean school, a lot of people go down to the islands to study. It's $37,000, $150,000 for the degree, maybe as much as $3,000. Let me do that again. It's $37,000 for the degree, or as much as $70,000 for a Caribbean school. The average cost of the medical education in the United Kingdom is about 38,000 pounds. You tell me. You compare $241,600 with the prices that they're paying in other countries, and you tell me whether we're getting overpaid. Some other data that is of interest here that's also important is, well, and how expensive is it to live in the United States compared to other countries? I mean, if the price of the cost of living in the United States is, I don't know, equivalent to that of Egypt, which is ranked 139th in the world in terms of most expensive, that's very low. then maybe we should be getting paid less. But we're actually getting paid. We're actually living in the 12th highest cost of living country in the world. And by the way, the cost of running a medical practice is even more expensive. How about the percentage of healthcare, of the healthcare expenditures that are accountable to physicians? You're a doctor. You're getting paid all this obscene amount of money to pay back the loans. By the way, another statistic, most of the people who finish paying their loans, they don't pay it till they're about 42 years of age. So you're paying your loans back till about 42 years of age when you go to medical school. You still think we're getting paid too much? And by the way, we're doing that so that we can not only see patients, not only can we be under the stress of seeing patients, not only can we be under the gun of lawyers who are just dying to make money off us by suing ourselves. You can put in your favorite noun in that sentence at the end. Not only is that happening, but they're making us fill out all these medical records. So when we go home, the guys what we talked about, the guys in California are probably still punching in keyboards to try to keep up, to document the day's events. At least, what are we now? Probably at 6:30, 6:45 over there in the West Coast. That's insane. That's insane. Yet, studies like this, by only giving you the direct comparison of how much we're getting paid compared to the payment in physicians in other countries, that's what they imply. No, the bottom line is this. The bottom line is that the only way to determine whether physicians are getting paid too much or not is to open up the free market. Let us compete. Let us see if the patient is willing to pay for the care that we're willing to provide. Let us see if they'll go somewhere else. Let us see if we need to cut our prices, because guess what? Patients don't want to come to see us because we're charging too much. That's how you determine whether we're getting paid too much. Not some survey that doesn't take into account all these other factors. They're not extraneous. They're inherent factors in becoming a doctor and being a doctor in the United States of America today. I'll tell you what the AMA's answer to this is, and this is decidedly not the answer of the United States Medical Association. The AMA's answer is to redo the way in which we get paid for the quality of our service, which goes back to the comments that we were making before. If you check the mark, then you're going to get paid full price. If you don't check the mark, never mind, that has nothing to do with what you do. If you don't get an obesity score on your patient when you're a urologist, if you don't find out about whether the patient's gotten your vaccines when you're a nephrologist, if you don't figure out what the bone mass density is on your patient who's greater than 65 when you're a plastic surgeon, then you get deducted. So you're not getting paid for the services you performed. You performed an absolutely beautiful breast reduction that was needed, not cosmetically, but medically, because the patient had symptoms, back pain, her breasts were too big, needed a breast reduction. You did it, came out perfectly, no complications. But because you didn't do all these other things, you get paid less. But you performed the service, but you get paid less. You do a hip fracture on a patient who's really sick. You got him through the operating room. But because you didn't fill out, a post-recovery form on how well the patient was functioning, you're going to get paid less. That's the system that the AMA thinks is an appropriate way of figuring out whether we're getting paid appropriately. And they're doing this because they figure that they can use cost controls or payment incentives to incentivize quality. This is absolutely a sleight of hands. This is absolutely false reasoning, and this is exactly the reason why we're falling into the traps that we're falling. The answer is this, ladies and gentlemen. The way that you figure out, if you perform the service and you performed it correctly, you deserve to get paid. Period. before you perform the service, especially if it's not an emergency room patient, by the way, 90% of physician interactions are not in the emergency room. So let's not say that the reason why doctors have to be regulated is because of emergency care. No. 90% of physician interactions are not emergencies. So if you want to regulate the 10%, because none of us want to take advantage of people who are not in a position to negotiate, well then, let's work on that. But don't tell me that the whole medical industry has to be regulated to the point where the government gets to decide not only how much we get paid, but they get to decide what services we have to give the patient, the quality of the type of care that we have to deliver in order to earn the full complement of the payment. That's not how America works, ladies and gentlemen. The way America works is you contract independently without any outside interference. It's a meeting of the minds. Both parties decide that it's a good idea to proceed because you're a great doctor or because you're a cheaper doctor, whatever the factors may be. You engage in your contract, you deliver the service, you get paid. How do you determine what's a price incentive? What's the incentive for doing well? Getting more patients. You do the services, you get a good reputation in your community. Now with the internet and with people saying all sorts of stuff that is not completely accurate, but nevertheless, it's out there. Now with the information that people have easily at hand about how well you do or how well you don't do, you can earn more patients, or you can get less patients, or you can move to another town and find a market that needs another doctor. That, my friends, is how you determine whether somebody gets paid more or less, is by earning more business, not by meddling with the amount of money that you deserve after you perform the service. And that is what we're going to fight for at the United States Medical Association, because only by fighting for this will we be able to actually take care of patients in the way that our training taught us to, in a situation where the patient calls the shots and you provide the expertise, not some third-party payer stationed in 7 states away that you may have to talk to somebody in another continent to get authorization for your procedure or your test. That's what we're fighting for. So, if you believe that this is the way we need to go, if you believe that this is what we need to do to take back our profession, then I urge you, please, join the United States Medical Association. It's $250 for physicians a year. It's very affordable for a doctor, despite all the things that I was talking about. It's a reasonable price. It's less expensive than our competitors. And we will provide you the representation that you deserve, which is you will have somebody that will be taking care of your profession, and by extension will be taking care of your patients. Come visit us at United States usmedicalassociation.org, usmedicalassociation.org. Follow us on Twitter. It's US Medical Assen. US Medical Assen. That's the handle. On YouTube, it's the United States Medical Association. And if you want to email us, then just email us at usmedicalassn, that's usmedicalassn @gmail.com. Once again, thank you so much for having been a part of this show. Thank you for listening. Thank you for watching. God bless you all, and let's see each other again soon.